We get it. There's lots of different ways to achieve your study objective and tons of material in AMBOSS for your next exam.
We can show you how powerful the AMBOSS QBank can be by guiding you through the different parts of exam preparation and custom question blocks.
Join us, Remy
and Abigail,
on June 3rd at 12 p.m. Eastern Time for a comprehensive tour of our QBank and learn how to save time and score high on your next medical exam.
Hi, my name is Anna. If you're preparing for your Step 2 CS exam, I'd like to show you how AMBOSS can help. The Step 2 CS test involves an examinee and a patient. Angela will take the test in a few weeks, and Afonso is helping her get ready. Together, they'll walk us through a case. Friends acting as practice patients can find explanations in layman's terms, so they can support your studying without a medical background. Each case is unique, with different patient instructions and dynamic real-life challenges. AMBOSS CS cases create scenarios that will help you be ready for the cases on your exam. So while Afonso is getting ready, Angela is reviewing the doorway information and preparing her blue sheet. In AMBOSS CS, you'll find an opening scenario, vitals, and examinee tasks, designed to get you thinking about differentials. Okay, it's time to start the clock. Enter the room and introduce yourself to the patient.
Hi, I'm Dr. Williams. Nice to meet you. So, what brings you here?
Well, I started having a little difficulty swallowing.
Ask the patient some questions related to the case.
So, do you have any allergies?
No, not that I know of.
An AMBOSS checklist is there to help. Using mnemonics can help aid in memory and patient vitals, which can be found in some of the cases within AMBOSS.
Have you ever been hospitalized?
No.
Next, Angela will examine Afonso. Don't forget to wash your hands. And stay calm. You have everything you need at your fingertips. Each AMBOSS case is realistic and includes a detailed physical examination checklist, so examinees will feel comfortable and confident while performing the exam.
So, Afonso,
After the examination, you'll have a closure and counseling talk with the patient. Your communication and interpersonal skills are just as important as the clinical encounter. Use the patient's correct name, show empathy, and look the person in the eye. Each case lets you practice and assess these skills.
Thank you.
welcome.
During the CS exam, you'll have 10 minutes to write up your patient notes. That means you must work fast. AMBOSS replicates what you will see on exam day, so you'll be ready. Compare your patient notes with the samples written by AMBOSS physicians. Within each case, you can review DDX tables, watch physical examination videos, or hover over speech bubbles for a more in-depth overview. The AMBOSS CS package is the only resource you need to pass your exam.
Man, I can't get anything right.
Nephritic syndrome?
Yep.
I'm struggling too.
What should we do?
I need to work on my nephrology.
Yeah, me too.
With AMBOSS, there's no need to continue juggling multiple resources. Every question within the AMBOSS QBank directly corresponds with an integrated learning card, giving you the option to dive deeper into any medically related topic. Everything you need is now available, in one place.
Did you know AMBOSS isn't just a QBank?
Students and physicians around the US are using AMBOSS as a clinical companion on the wards. Whether you're being put on the spot by your attending, wanting quick access to reliable, high-yield information in the clinic, or trying to fit in some shelf study in your downtime, we're here to show you some tips and tricks on how students are using AMBOSS to succeed in their clerkships.
Join us, Olivia and Georg, on Sunday, May 20th at 12 p.m. Eastern Time to learn more about using AMBOSS on the wards.
See you there.
Hey guys, my name's Johanna Hase. I am an editor at AMBOSS and I'm also an attending internist. I did my med school at University of Washington and residency at NYU in internal medicine. I'm joined today by Tim. Tim, do you want to introduce yourself?
Hey, yeah, I'd be happy to introduce myself. My name is Tim. I'm a current M4 right now at the University of Michigan. I'll be applying into anesthesia, and yeah, I'm an AMBOSS user.
Cool.
Yeah.
We're really happy to have you here.
Of course.
So today we're just going to be talking about Step 2 CK, the exam, how to prepare, and also a little bit about how AMBOSS can help you with that. So you just recently took Step 2. How did it go?
I did just recently take Step 2. I thought it went well. Studying for Step 2 was very different studying for Step 1, I would say.
In what way?
My school, as most schools, don't offer a designated Step 2 CK study period. Instead, we have to kind of fit Step 2 wherever we can in our schedules. So with regards to studying, I'd say I had to be a bit more deliberate and more focused with my time because there's just a shorter amount of time to study for it.
Yeah, totally. I remember that being really hard too. You don't have as much time to study.
Exactly.
How long did you take to study?
So I took 3 weeks. And the way I kind of divided up my studying is that the first week to week and a half, I really focused on content. I really looked for the things I was weak at, the things that I needed to improve on. So for me, the big thing was OB-GYN. And if you look at my shelf scores throughout the entire year, my OB-GYN score is the weakest of them all. So I spent a lot of time doing that. The latter period was more on time management and being focused about, okay, how can I get each question right in a 90-second window or less?
Okay, cool. So you mentioned 2 really important points. So one is that people can use their STEP exams and their clinical rotations to kind of guide what they're weak in and work on those specific fields.
Exactly.
And the second thing you mentioned is that time management is a big issue.
Exactly.
Both in regards to amount of time you have to study and also Step 2 questions are really long. The stems are long. It's a hard test.
Right.
Okay.
Right.
So we can kind of talk about what you did specifically to address those.
Yeah, I'd be happy to. So with regards to content, I guess, I think that might be an easier place to start off. I really focused on learning every single thing I possibly could from a question.
Okay.
So the way I looked at it is each question had a focus and it had a point, and there was a reason why I was doing that question, and there was a point to carry away from it. So whether I got the question right, whether I got it wrong, it didn't really matter in terms of dedicating time to that question, because I knew that if I understood why a question was right and why the wrong answers were wrong, I could get a much, much, much better idea about what the point of that question was, and I could carry this knowledge over to future questions that cover similar topics.
Okay, that's great to know. And did you do that for the whole time you studied, or did you change anything?
Not really. So not really, I didn't for the whole time, that is. I took my time more in the beginning, but getting closer and closer to my exam, I really focused on time management. So I would take timed exams to kind of prep me for that.
Okay.
Yep.
Yeah, we hear that from a lot of people, that's a really good way to prepare for Step 2. So maybe we can kind of go through a sample question, and you can kind of show us how you kind of tackled them.
Yeah, I think that'd be a great idea.
Okay, sounds good. So we're just going to open the screen. We need to go to the other tab. Okay, we have the mouse. Okay. So here's kind of a classic Step 2 question, right? It's a super long stem. It's you look at it and you're already stressed out about it. How do you kind of approach this question?
Sure, no problem. So before starting a question, or reading the entire question stem, I should say, I did 2, in my opinion, really, really important things. I would read the first sentence, and I would read the last sentence.
Okay.
Because I thought that these 2 sentences were the most important parts of a question stem. So let me give you an example. So right away, we're looking. The first thing we see, a 67-year-old woman. This lady isn't young. She's brought to the emergency department. Okay, so this is obviously something of acute concern to her, for evaluation of a fever, chest pain, cough, with some funky greenish yellow sputum. Does that sound normal to you? No, and this has been going on for 2 days. So this is a subacute issue. We know this is not some random outpatient thing. No. This is a febrile old female patient coming with some funky sputum. You just told me that's not normal, so obviously right now we have an abnormal clinical picture and we need to figure out what we're gonna do about it. Moving on. I skipped to the last question, or excuse me, the last sentence in the question, which is, which of the following is the most appropriate next step? I'll repeat that again. The most appropriate next step in the management of this patient.
And why do you jump straight to the last
sentence?
That's an excellent question. So after getting a good clinical picture of what the patient that I'm looking at, I want to know specifically what this question is focusing on. So right by jumping to this last step, I know I'm not focusing on physiology. I know I'm not focusing on clinical nuances. I know that I'm looking specifically for the next most appropriate step. Not a next step, but the most appropriate step. So this way I can read through the entire question stem with a more focused and deliberate approach.
Awesome. Yeah, step 2 stems are notoriously full of distracting information, so that's a really good strategy to use. In this case, we can see the smoking is probably distractor, the medications, there's a lot of information in there, and that's a good way to kind of zero in on what's important.
You got it. You absolutely got it.
So what's kind of your next step?
Great. So at this point, I'll read through the question stem and I'll highlight things I think might be important. But let's say, for example, I'm not really sure what could be important. And I'm wondering, what would the test writers want me to take away from this? So there's this tool that AMBOSS has called the highlighter tool. And if I click it right here, you can see that these are the important points that the test writers want me to know. When it comes to the AMBOSS test questions, there's a team of content writers. And Johanna, I know you know a lot about these content writers. Do you mind telling us about who they are and what they do?
Thanks for that question. So we are a pretty large group, focused mainly in Germany and in the US. And all of our content writers are people who have taken the USMLE exams. So we can use our own experiences to kind of help guide what we write and really make it, just make the content spot on for what you're going to see on the actual test day.
Totally. So it's not just some random people who've never seen USMLE content
before.
Okay.
We try to avoid that.
Awesome. Great. So now that I know what the test writers or these content writers think I should know, I would like to go on to answer the question. But let's say, for example, I still am a bit lost. Hopping into the mind of a doctor might also be helpful to answer this question. So there's this cool little thing called the attending's tip. So if I click on it right here, it gives me a little tip to possibly guide me to the right answer. So we know that they're describing a patient with community-acquired pneumonia, but look, it brings up something called a CURB 65 score on, and that might help me get the right answer. So moving on, let's just choose something. Let's say A, right? Outpatient treatment of moxifloxacin. Do you think that's right? All right, let's click on it. Right, here we go, it's wrong. Now, if I read the wrong explanation and understand the wrong explanation, I can use this to now know, okay, how do I treat an outpatient with pneumonia? And this teaches me exactly that.
Sorry, one thing I'm just going to interrupt. This is something that we really focus on at AMBOSS too, is making sure that our incorrect options also provide teaching points. So I'm glad to hear that you're using it that way.
That's a great point. And let me just show you guys a cool little feature that I like, is if you don't understand, for example, the CURB 65 score, that's a bit nuanced. What is that? If I just scroll over it, bam, that'll take me 15, 30 seconds to read. So
this is our phrasionary, and basically it's there so that you don't need to open an additional source. So everything is within one place.
You got it. Awesome. So let's move on to a more appropriate answer. How about this one? Inpatient treatment with the Zithro and cefotaximine.
You should be an internist.
I don't know if I'm smart enough to do all that. But what I do know is that when I read this question, or when I read this explanation, I know why the answer is right. And it gives me a pretty detailed approach that's also concise. And here's this awesome graphic, which many of the correct answers or even incorrect answers will offer you. Cool graphics. In this case, it's a triage of how to treat these patients. And for somebody like me, who's a visual learner and a conceptual learner, this is quite useful.
I agree, yeah. I'm also a visual learner, so I find those features really helpful.
Awesome.
And then what if you went through this question and then you realize I need to brush up on my pneumonia treatment or my antibiotic.
What is pneumonia?
What is a CURB 65?
Great.
What do you usually do next?
So there's a learning card associated with every correct answer, and this learning card is on pneumonia. So I can go over, and everything that's relevant to this particular question within pneumonia, so in this case it's treatment, bam, is highlighted in green. So it tells us about, if the CURB 65 score is below 1, 2, etc., what to do. And the learning card is just right here. If you want a brief snapshot of what pneumonia is, you can read the abstract. And if you want to know more about specifics, you can go on and look at specifics, according to the general topic that it falls under, all regarding to pneumonia.
Awesome.
Yeah.
And I don't quite remember, is there a lot of imaging on step 2? It's
Yeah.
been a little while. Yeah.
Yeah, certainly. There's a lot of imaging on step 2. And somebody who just took step 2, let me tell you that if you recognize imaging on step 2, whether that be x-rays, that be skin findings, that be biopsies, it definitely saves you a lot of time.
Okay, cool.
Definitely.
Maybe we can just show this on this x-ray too, like how AMBOSS approaches images.
So even,
since we're there.
Yeah, that's a great point. So here is an x-ray. As you can tell, it's lungs and a heart.
Good job. Great job.
But let's say you're not sure what you're supposed to be looking at. There's this cool feature called overlay, which my mouse is on right now. And if I click that, bam, I get an overlay of what I should be looking at. And this actually gives me the anatomy of the upper, the middle, and lower lobe, but also this important little area right here to show this is where the pneumonia is.
Yeah. Cool.
Awesome. So have you ever heard of the term or the phrase where like it takes a person 10,000 x-rays to be able to recognize an image?
I sure have.
I think this probably cuts that down to maybe 1,000 or even less. So.
1 in 1,000.
Yeah.
Off to a good start.
Groovy. Okay, cool.
All right, cool. So we've kind of gone through like a sample question, the learning card, and how you can use that to kind of help you prepare for step 2.
Certainly.
You also mentioned time management. It's a big struggle.
Yeah.
So what should students? How should they prepare? What's the best way to go?
That is an excellent point. So. Once you get a kind of a grasp on clinical knowledge, time management practice through timed tests becomes quite useful.
Okay. And how much time did you have per question? Did you already say that?
Yeah. So I budgeted about 90 seconds a question.
Okay.
The test itself comprises 8 sections, each of them 40 questions, and you get an hour to do each. So if you divide that down as 90 seconds a question, or the way I thought about it was 10 questions per 15 minutes. So I'd always keep a mental clock about, okay, now that I'm 15 minutes on, like, have I done 10 questions? And I think doing timed questions really helps me.
Okay,
Yeah.
cool. Yeah, that's a really important part of studying for step 2 is timing your questions and simulating the exam.
Yeah.
So we're going to open up our second tab and kind of look at how you can do that within AMBOSS. So within the custom session of your QBank, if you scroll to the bottom, you have study mode and exam simulation. Study mode is kind of like your just regular way of going through questions, taking your time. Exam simulation is going to do what it says it will do and simulate the exam for you. So this is a really great way to kind of get in that practice of what you're going to see on the test.
For sure. So for this, everybody's taken step 1 could probably recognize that this is what a step exam looks like. And as somebody who just took step 2, this is precisely what a step 2 question looks like. And in fact, all of this is very step 2. It's a little fun, I guess, to re-jog my memory of step 2.
A little bit of PTSD for you, probably.
Yeah, there we go. Maybe I should get some medication for that. But anywho, yeah, I think this is quite useful. It's always better to understand what you're getting into before you do it. Things are less scary if they're familiar.
Yeah. That's an excellent point. Okay, so we talked about kind of going through questions in depth. We talked about doing timed questions in like exam mode. Any other advice or tips you have for people out there?
Yeah. So for me, one thing I found particularly helpful on the words and for step 2 as well was the learning cards. Sometimes they generally speaking, it's easy to mix things up in medicine. You learn a diagnosis that's very similar to another.
Yeah.
So really understanding the full breadth of a topic in detail, for example, like Crohn's disease in detail, can help me differentiate from UC. They're both IBD, but they're quite different.
Yeah.
And even AMBOSS actually has this cool little chat talk on Crohn's versus UC. So really understanding these nuances and diseases, I think, is quite helpful as well.
Yeah. I also remember really, using the experiences that I saw on the wards and things I saw on the shelves and being able to apply those to step 2 was really helpful too.
Oh, certainly.
It's a lot easier to remember something when you've actually seen it on the words than if you've just read about it.
Yeah, totally. It's a lot easier to remember Mrs. X and remember about, you know, how she was concerned about her Crohn's disease than it is to just memorize a bullet point.
Yeah, I totally agree. So that's one thing that I would recommend for all of you guys out there who are preparing for step 2 is, you know, remember that you do actually have a lot of experience already, and applying that to your studying is going to be really helpful.
Totally.
All right, so let's see, what's next? What about the night before, day of? What tips do you have? And then after that, we'll go through some of the questions that have come up.
Oh yeah, I was chilling the night before.
Okay.
I think that helped decrease my anxiety a lot. My girlfriend and I made dinner. It was relaxing, and I walked into step 2 with a pretty chill mindset, which ultimately I think benefited me.
Yeah.
Yeah.
I think that's probably really hard to do.
You gotta at least pretend. Fake it till you make it.
Yeah. That's that's a good point.
Yeah.
And what about snacks? Anything else for the day of that you recommend?
That's funny. So for snacks, don't overdo it. Like, bring what you need. Like, I definitely went to the grocery store and went like pretty crazy.
Yeah.
I mean, if y'all took step 1, it's similar. Like, you get a locker, and like sometimes they're really small, and you don't want to like stuff things in because then it's awkward. So, take what you need, but don't overdo it. I know some people like did, and it was quite stressful for them.
Yeah.
I really like granola bars and sandwiches. So.
Yeah. Cool. Yeah, I remember buying way too much food, and then I didn't touch any of it. What about your breaks? Like, how did you split up the breaks that you had on?
Yeah, that's a great point. So, as I said, it's an 8-section exam, an hour each, and then you get 45 minutes technically of break and 15 minutes of a tutorial. If you skip the tutorial, which I highly, 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 highly recommend you do, then you get an hour of break. So it adds on to your break time. So what I did is I took the first 2 sections back to back, and then I took a break, and then after that I took a break every section.
Okay.
And I budgeted my time accordingly.
Okay,
Yeah.
cool. That makes sense. And then I'm going to ambush you. Is there anything you would have done differently?
Is there anything
Looking back at your
I would have
studying?
done differently if I would have? That's a very, very fair question. No. Honestly, I don't think there is. I think I gave it my all, and you know, my life's motto, if you will, if we want to get a little personal, is that
we do.
Yeah. Why not? My life's motto is that I want to be like, if you guys follow basketball, LeBron James just hit a game-winning shot last night, and he also hit one 2 games ago. I want to be able to last shot in the 4th quarter. Swish it so my team can end up winning. My team being my motivations, my ambitions, my personal desires. The effort, the entire game being my stamina and my desire to succeed, and that last shot being you've done it. So I kind of live for that gratification, I guess, at the end of the day.
Cool.
Yeah.
You should really think about switching into internal medicine.
Who knows? You might convince me.
Okay, so we have a few questions out there. I think we can switch to that.
Awesome.
So the first question is AMBOSS only for Step 2 CK?
Great.
And that's a great question. So Step 2 CK is kind of our oldest product, if you will, that we have out there. But we actually just also released a Step 2 CS package that is available as well. And we're currently developing Step 1. So that will be probably sometime later this summer, early fall.
There's a question that STHM beef. Sorry, I'm totally butchering. I'm like trying to read this. Anyway, you actually have an incredible question about dividing things up versus topic versus just doing random. So the way I approach it is if I needed to really focus on, like OB-GYN, for example, by far was my weakest subject. At the beginning, I would divide it up by topic so I could learn my OB, but I quickly switched out of that because I knew that I wanted to have the most realistic Step 2 CK experience as possible. And everybody that I talked to from my university and years ahead of me as well did the same thing. They would focus early on, and then once crunch time came about, they would try to get the most realistic experience possible. So I think that's a great question, actually. I'm not sure how you did it for Step 1. For me, for Step 1, I actually didn't do any I didn't do any customization. I did completely random. But I think the big difference between Step 1 and CK is that for Step 2 CK, you have this clinical experience. And I'm going to spill the beans a little bit about this actually. So your shelf scores your shelf questions are essentially step 2 CK questions. The same content writers work for both the right content for the shelf and for CK. So you've been taking CK questions if you're an American medical student throughout your entire clerkship year. So I guess focusing on a specific topic might be a bit more useful at the beginning of a step 2 period than maybe for like a step 1. But that being said, at the end of the day, I think it's just so important to simulate real life conditions because what I said before, what's familiar isn't scary.
I totally agree with you. I think being focused in the beginning on whatever your weak points are, but then moving to randomized is the best way to go about it. Okay, one question about the last 20 days of prep and the last week. How should we prepare? What are the priorities?
Yeah.
Do you want to take that one?
Yeah, that's totally fair. Well, VINN, sorry, don't have great vision. Anyway, that's a good point. So I think that really depends on how you've been studying all along. So that's actually, as much as I want to give you like a specific answer, I can't because if you've been studying for this, for example, for like 2 months, last 20 days is going to be, I would probably recommend very focused, like, very like time sensitive. So you want to like keep on doing time tests. You want to do things on random. You've been going for a long time possibly at this point, so you may want to like kind of judge where you're at. Like, do you have the stamina to continue and go 100%, or do you need to like recuperate for a couple days and then catch things up to speed? Whereas me, for example, and a lot of students in my university, we normally don't take much longer than like 3 weeks because we just come off of our clinical rotations and then take it. So if you're studying like me and you have like 3 weeks, maybe a month, actually I wouldn't really give you any different advice. Just keep random questions, create a study schedule for yourself. It's really a tough question to answer. I'm really sorry I can't be more detailed because it really depends on how much dedicated time you give to step 2 CK.
Yeah. One other thing that I would just add is for the last week, I think another thing that can be helpful is just doing some also pure memorization. Like if there's things like nephrotic syndrome, nephritic syndrome, where it's something you're always getting wrong, those are easy points to get if you just do a little bit of memorization. So kind of in that last week is where I would kind of solidify that stuff.
What is the most useful mnemonics for deep understandings? That is a great question. Sorry? Oh, so for me, I think there's just some classic ones that, I don't know if you're an American med student or not, but that I learned. Like from Jane, I always thought was useful for endocarditis. Like you can, it creates a clinical picture right there in the mnemonic. So if somebody's febrile, like Roth spots, I guess aren't as useful, febrile or nodules, stuff like that. I get smashed for acute pancreatitis. Actually, that's like a really high yield one on second thought. I get smashed is really high yield. So yeah, I highly recommend that.
But I think, is the question more like whether to memorize mnemonics or whether to have a deep understanding? I think that's more the question.
Oh,
sorry.
I see. No,
those are good mnemonics, though.
I totally, I was like, I feel like I'm just saying things right now. People aren't going to be. Anyway, so that's actually a really good question. Thank you for bringing that up. For me,
it's tough.
I think they oftentimes work well together. So if you have a mnemonic that teaches you the pathophysiology, the management, etc., like that's quite helpful. For example, I get smashed one, that's all the causes of pancreatitis. It doesn't tell you how you get pancreatitis, but it tells you what causes it. So if you understand pancreatitis as acute pancreatitis as a clinical picture, as a diagnostic, as a management, as a risk factor type thing, I think maybe adding on mnemonics on top of that could be useful, but just cold memorizing mnemonics, just memorizing them, hoping that you'd get a right answer from get a test question based on your mnemonic, I think is a little bit less realistic. Mm-hmm. Thank you for driving me on track again. I wasn't quite sure what you mean.
All right, a few more questions. Ooh.
Oh, okay.
So the UWorld.
Where's that one?
The highlighted.
Oh, okay, gotcha. Yeah. So that's an awesome point. So in the U.S., the major other product is UWorld, and I'm sure other people use it too, actually. But I'd say the biggest differences for me, they're both excellent products. Like, to be completely honest with you, like, UWorld is an awesome product, AMBOSS is an awesome product. I think the distinction is how important is it for you to have an associated, let me phrase it like this. UWorld does an excellent job of taking a snapshot of a particular problem and teaching you about that snapshot. They do a great job. What gets a bit more difficult is if you want to get deeper knowledge about that particular subject, you can't, there's no way of accessing that. And that's what gets hard. That's a hole that, in my opinion, UWorld has. AMBOSS, I think, fills that hole really well because with the associated learning card, for example, with the pneumonia one, that associated learning card that you're actually seeing to the right of your screen, it teaches you everything about pneumonia. Everything from point A to point B. If you're curious about the epidemiology, you can click that thing open and bam, you're there. So it's not necessarily a snapshot as much as it is a way of assessing your knowledge about a particular subject, and if you want to brush up on that subject, bam, you can right there. I'd say that's probably the biggest difference, at least for me.
I agree.
And also like the like highlighting tool, that's also huge because it lets you know what you should look for in the next question. The physician's tip helps you like realize, okay, what are the test writers wanting me to think? And then I think a more detailed explanation of the wrong answers too. So I won't focus too much on that, but as a learner who is primarily like conceptual and visual, I think having the associated learning card right there is really helpful for me.
Mm-hmm. One other thing I'll just put a little plug in for that we don't have to talk about today, but I think AMBOSS is also really great for using on the wards. So it's a good way to kind of integrate your studying with also what you're seeing on the wards.
So,
and that's something that a lot of other products don't have.
I completely agree. I mean, I'm sure a lot of you med students out here have had to make presentations for your attendings, like PowerPoint stuff.
Yeah.
I've literally just copied and pasted like AMBOSS, like bullet points into my PowerPoint. So it's pretty useful for on the wards as well.
Okay, and then I think we'll take this as a last question. So rolling off of step 1 with an average score and dedicating 3 months for step 2. Any advice on how to efficiently utilize that time?
Yeah, that's a great question. So 3 months, I think you have the luxury of time, so you can probably take your time. The whole notion of reading each question very carefully and the wrong answers very carefully, you have a lot more time to do that. So I would probably focus more on that. You already taken step 1, so you know what it's like to take a standardized medical exam in the US. And if you dedicate, let's see, you said 3 months? Yeah, if you dedicate like 1 month out of that 3 months to like times, like let's go, you'll be in good hands in my opinion. I think 3 months is, you'll be fine. Very fine, yeah. CS as well, like I think honestly just smile a lot, but that's a different topic. Yeah.
One thing I'll add to, I will admit that I didn't have like the greatest score on step 1, but then I did really, really well on step 2. And a lot of the reason for that is that I just had clinical experience that I was able to apply. So I really would emphasize like how important that experience is and don't underestimate how helpful that can be for your study prep.
Yeah, cool.
All right, so I think that's it for today.
Really?
Thank you so much for being here, Tim.
Yeah, thanks for having me in warm, sunny Berlin.
Yeah. So we have a code that will be at the bottom of the screen, and we'll give you a free 2-week credit for AMBOSS. And even for those of you who already have AMBOSS and are using it, thank you. But use this code. It'll add on to your credit for the year. And yeah, thanks so much for coming, and good luck with your studies.